Dr. Gerald Clum will be speaking later, and he is a national and international expert in the field of chiropractic healthcare and is the president emeritus of Life Chiropractic College West and on the faculty of Life University now. All of these people have other great things. I'm skipping over that.
I'm going to shift everything here just a little bit so I can see it along the way. Thank you very much. It's a thrill to be here and participate in this. I'm going to represent the perspective of the chiropractic community and the chiropractic component of this discussion. I'm going to try and drill down a little bit and get a little bit more narrow, as you might expect, as we move a little bit deeper into the discussion. The reality is we've got a tremendous gap, and the gap is killing us as a nation. And that gap exists between the knowledge and the materials and the information we have to work with and the practices, policies, payments, and the perspectives of the system. It's what we've heard talked about here for the past hour and a half. And all of these things are contributing to creating this gap. And the task that government has, the task that we have, is to try and do things that fill that gap in a constructive and productive fashion. You've heard other speakers this morning talk about the fact that we're transitioning out of an infectious disease management world into a chronic conditions-oriented world. We're also moving out of a provider-dominated world to a world that is dominated by lifestyle issues, that's dominated by genetic issues, dominated by the involvement of the individual. And we've seen the transition in patients from the patient who just does what they're told to the patient that's going to tell you what they're going to do and how it's going to be done. And ultimately, we're seeing the transition from fix to prevent. Some of the easy and low-hanging fruit for this discussion, the reality that we think about when we think of healthcare is we think about the things that kill us quickly and kill us in horrific ways. Cancer, heart disease, stroke, so on. These are the things that come to our mind most often. But worldwide, the number one cause of disability is not cancer, is not heart disease, is not stroke. It's in fact spinal pain. If we take it a little bit further and we think about the moment that we're in relative to this pain, and we look at the overall world of chronic pain here in the United States and the opioid use environment that we're in right at this moment, we have a perfect storm that demands change and demands an end of business as usual. And we have an urgency that calls for new players, new practices, new strategies to get this done. Looking at the dollars and cents, imagine this, if you will. These are 2010 data. In the United States, we spend $600 billion on pain. If we look at the cost that we spend on cancer treatment, the cost we spend on heart disease treatment, combine them together, and it's less money than we spend on pain in the United States. We're getting a not-so-good return on the investment, and we're getting an awful significant downside to the approaches and the treatments to that management that we are employing. 1/4 of all opioid prescriptions written in the United States are written for low back pain, when all of the guidelines from the Institute of Medicine, the CDC, the Food and Drug, the Joint Commission say don't do it. And if you do it for a day or two, maybe 3 or 4, but that's it. But instead, that patient, as the general made reference to, gets that handful, that full bottle, and in 6 weeks, they're addicted. We look at the IOM report, we look at the FDA report, we look at the CDC guidelines, and they have one thing in common: non-opioid approaches and non-pharmacological care. That's the order and the recommendation from the hierarchy of the system across the system. And we now have the opportunity to try and implement this across the board, as I said before, through practice, through policy, and so on, and in the perspective of the care that we offer. Now, for any of you that can read this slide, you're doing much better than I am based upon where you're sitting. But let me just jump to a couple highlights. This is an analysis that was published 3 weeks ago from the state of New Hampshire dealing with the management of low back pain in the non-Medicare, non-Medicaid environment, based on 2013 and 2014 data. When chiropractic care is present, the costs are $1,513. When they're not, the costs were $6,766. A year later, the numbers went to $2,000 and $7,000. If we look at the opioid impact component, in 2013, when chiropractic care was available in this environment, the cost of opioids was $154. When it wasn't available, the cost of opioids jumped 4 times to almost $600. A year later, the same ratio, 200 to 900. The bottom line is we've had significant costs. If we look at what that data tells us, is that in 2013 and in 2014, there was 74% lower opioid costs, 78% lower clinical care costs associated with the use of chiropractic care. We take it down another year, and it was 78 and 71. The bigger issue is the lifetime utilization within our society of chiropractic care is about a quarter to half of the population. 8.4 to 14% of the population use chiropractic care on an annual basis, and the primary reason they do is for back pain and neck pain. But the important and the thing I'd like you to take away from my part of this discussion is the changes. This is from literature that was published less than 3 months ago, published in Spine, and it was an analysis of the National Health Interview Survey regarding the impacts of chiropractic care. And that the consumers that responded found that chiropractic care gave them a sense of control over their health, almost a third of the population that responded. It helped to reduce their stress level or helped them relax, 40%. It helped them sleep better, 42%. It made it easier to cope with their health problems, 4 out of 10, and improved their overall health and well-being, 67% of that population. The general made reference to talking about the issues associated with mood, with activity, with sleep, and with stress. And I think if you look at that slide, it embraces all of those. I'm asking 6 things on behalf of my world in this discussion. We need to increase the budget of the National Center for Complementary and Integrative Health to fund the comparative research and systematic reviews needed to better understand the clinical and economic value of integrated care. We need to address the restrictions inherent in the Medicare system related to payment of various forms of integrative care. And we need to encourage the full implementation of non-pharmacological approaches in pain management. We need to expand the active duty military and veterans access to integrative care and have it provided by persons with the capacity and expertise in those disciplines. We need to appreciate and respect the feedback of consumer-driven information, such as the National Health Interview Survey, my apology for the slide error, related to complementary care, as I've illustrated relative to chiropractic care, and then ultimately support and implement the spirit and intent of Section 2706 of the Patient Protection and Affordable Care Act. Thank you, ladies and gentlemen.